Talk us through what the symptoms of monkeypox are exactly.
For the moment, it's difficult to know the symptoms in European or Western patients because we are more used to the symptoms we see in in endemic areas. But as far as we know, in Westerners, it gives rise to cutaneous lesions around the genitalia on the buttocks, and also on the palms, on the face. And it is associated with fever, muscle pain, and headache.
And why are we seeing human to human transmission in Europe now?
This is a very good question, but it has been showed in Africa that human to human transmission may occur during outbreaks that have been described in Central Africa and at a lesser extent in Western Africa. But it's the first time we are facing autochthonous chains of transmission in Western European countries as well as in North America.
How severe is monkeypox and should we be worried?
Probably it's not so severe, but honestly, we have to know that we don't know because the only experience we have about the severity of the disease is drawn from American experience, from African experience, and it will certainly be different in Europe, mostly because these are mostly young men, less at risk of complication than elderly or immunosuppressed patients, knowing that some of these patients may be immunosuppressed. We have to check.
Does the smallpox vaccine protect against monkeypox?
Yes, it does, undoubtedly. It has been shown in Africa for decades. People who received vaccine against pox virus during childhood are protected against monkeypox.
Health authorities in Spain reported on Friday that 23 confirmed cases of monkeypox were discovered nearly around the Madrid region, where the regional government were forced to close down a gay sauna where they said a majority of the infections were linked to. It seems that monkeypox is affecting the gay community a lot more. Is that right?
Yes, this is absolutely right. It's also the same in the United Kingdom and also in Canada. Yes, it's undoubtedly true. And in Spain, contamination has been traced to a gay sauna, but in Belgium, it has been traced to a gay festival. So, yes.
So, what should the community be doing, the gay community be doing differently?
I think they have to be very cautious regarding chain of transmission. I think the key issue is to diagnose people with monkeypox and to isolate them, then to trace, if possible, their sexual contacts and isolate such people. And I think we will stop the disease.
Is it worth giving somebody who has been infected with monkeypox the smallpox vaccine after they've had monkeypox?
After they had got it, no, it's probably useless. But one may discuss the interest of vaccinate people around a case.
And you said that from what you're seeing in Europe, it's affecting people differently than in Africa.
Yes, probably. It's not the same way of contact. Even in Africa, human to human transmission has been evidenced during at least 4 outbreaks. So we know that virus can be transmitted through this route from one to another.
Doctor, can you confirm that in Europe we have discontinued the smallpox vaccine, right?
Yes, we have discontinued smallpox vaccine at the end of the 70s. 1977 in France, for instance.
Okay, Dr. Ericom, you're
So,
gonna have to. Thank you very
so
much. Go ahead. Go ahead.
no, so it means that people over 45 years old are somewhere immunized against monkeypox.
Okay, people above 45 are somewhat immunized. Dr. Ericom, thank you very much for joining us on the program today.